The Center for Orthopedics and Movement really is the culmination of many years of work.
Our understanding is expanding exponentially. There's no one doctor, physical therapist, subspecialist who can understand the whole system. It takes a team.
We have always believed that we could craft a more comprehensive approach, a more global approach for the Seacoast community and the members of the Seacoast community who have significant physical disabilities, who might have significant injuries resulting from sports activities, or have the regular deterioration of joints and bones and muscles that occur with an aging population.
The ultimate outcome is the restoration of motion, but to get to that point requires multiple subspecialties and a relationship with the patient and their primary care doctor to achieve the kind of outcomes that we expect.
On any given day, primary care provider sees 20 patients. It's probably 8 of those will have musculoskeletal related disorders. Some of those are easily handled in primary care and just with a referral to different therapies, but others certainly need and warrant a specialist's intervention.
Medical care has become incredibly specialized, incredibly sophisticated, such that you have a specific doctor not just for a bone and joint problem, but for a specific bone or a specific joint. And it's very easy for medical care to become fragmented in that way. In the end, that trickles down to the patient having to make multiple phone calls to multiple providers in multiple areas to make sure that everything's aligned for their surgery or their procedure that they're going to have done.
Among the things that I see most beneficial for patients is probably the fact that we will have consolidation of all of the necessary specialists for orthopedic and movement care.
Core Physicians is a multi-specialty group comprised of over 150 specialists. We're excited to be able to extend that comprehensiveness to the Center for Orthopedics and Movement.
Core Orthopedics physicians and surgeons provide care for injuries and disorders of the bones, joints, and muscles.
Some patients don't always require orthopedic surgery. They may require rheumatology, neurology, consultations, other treatments that are available at our center that aren't available at every orthopedic office.
What you're trying to do is get the most out of every visit with a patient. By having a center that places services under one roof, what you're able to do is align yourself with the other providers to make the most out of every visit.
Core Physiatry and Spine Care physicians provide comprehensive non-surgical treatment of back and neck pain or injuries and have additional training in alternative medicine and sports medicine. When conservative treatment is no longer an option, Core Physiatry partners with coastal New Hampshire neurosurgeons who will consult with patients in our new center.
If you're having a concern about a patient, if you can go grab somebody and say, "Can you help me with this?" or ask a question of them at lunch, you are improving patient care in small bits throughout the day. And it really is such a benefit to patients and to us.
Core Podiatry treats patients with a wide variety of foot and ankle injuries and conditions, from common problems such as bunions to diabetic foot problems and sports injuries.
Well, I think it's all about patient care, and you really need to be able to have the ability to treat things that are outside of your subspecialty.
So there's going to be podiatrists and orthopedists in the same building, collaborating and working on these problems together. That is completely unique, not only in the Seacoast, but I believe in New Hampshire, and I think it's pretty rare in New England too.
My practice is primarily sports medicine, and I take care of everything that encompasses our athletes.
The sports medicine team includes providers from many of the center's practices. With diverse backgrounds and extensive sports experience, they provide comprehensive care to maximize function and return athletes to play.
The communication is going to be seamless, and as physicians, we're going to be able to consult with specialists in every field to get answers for our patients.
They may come and see the orthopedist, but then they may come see me for nerve testing.
Core Neurology provides expert diagnostic and non-invasive treatment for a wide variety of conditions that affect the nervous system and brain. Core Rheumatology provides therapeutic treatments to patients with arthritis and other rheumatic ailments, as well as many inflammatory diseases. The physicians work closely with their patients to minimize long-term joint and tissue damage and improve overall function and quality of life.
I work very closely with occupational therapists, and having the hand therapist in the same location is extremely beneficial to myself and to the patients.
Exeter Hospital's physical therapists, occupational therapists, and speech pathologists provide individualized rehabilitation services to people of all ages. Specialty services include aquatic therapy, spine and hand therapy, pelvic floor physical therapy, and neurological rehabilitation.
I'd be able to run upstairs to assist with a splint with Dr. Peelman, perhaps run over to consult with the rheumatologist on a patient who has arthritis, ultimately providing great patient care and great patient outcomes.
Alternative medicine services such as acupuncture and massage therapy are also located at the center, which complement other healthcare services by helping reduce pain and enhance wellness.
The Center for Orthopedics and Movement is an extension of Exeter Hospital and core physicians in a new and innovative way.
We have an opportunity to coordinate our care. We all share the same electronic medical record. We all know each other very, very well. We interact on a regular basis.
We have all the components to produce the outcomes that are in alignment with what the patient's desires are, and that is to restore their motion.
We have a more comprehensive view of the patient, a more holistic view of the patient, in which the various professionals can collaborate, innovate, communicate, and ultimately deliver better value for our patients. And that is really what the focus of the center is.